The philosophy of the scientific sessions is to present cutting-edge research or opinion that is not heard in other meetings throughout the year. Dr. Alice Cheng, chair of the planning committee, is here in studio now to discuss how her team has done just that for this year's gathering. Thanks for your time today.
Thanks for having me.
So you have a tall task. Your committee is responsible for developing challenging and exciting program content that really reaches across diverse disciplines. How have you worked together with your team to do that this year?
So the very first thing we need to do is, and I think of it kind of like the Avengers, we try our best to assemble the Avengers of diabetes. So trying to identify leading experts that cover 8 theme areas, which have about 25 content areas within them, in order to lead those particular sections. And then sort of late summer, early fall, we ask them to assemble subcommittees where they create the proposals for, be it debates or panels or symposia on their specific content area. And then after doing that, we then come together as a larger committee in the fall and hash it all out. Now, one of the asks that we have of the subcommittees as they create proposals is to come up with hot topics and important subject matters, but also to come up with potential speakers. And with that in mind, we try to be as diverse as possible and sort of cast a very wide net in order to capture all the incredible talent that's out there. But that coming together meeting in the fall is a very intense weekend where there is a lot of discussion, a lot of collaboration, negotiation, but it's critical because we sort of see where everyone's coming from and try to pick topics that will be of interest to a very diverse audience. And then there's the jigsaw puzzle of actually assembling it so that it fits within the time span of the conference, not to mention all the abstracts and the many abstract reviewers, and then the ADA staff that really does a lot of heavy lifting. So I have tremendous thanks and gratitude to the entire committee for the huge job of making this conference come to life.
Right, I can't imagine trying to take all of those ideas and all of that content and whittle it down into something that's digestible over 4 days.
Yeah, there's a lot of negotiation and thinking.
Okay, so now that we are here, what are some of the key offerings that you're excited about for attendees this year?
So there's going to be over 200 sessions, hundreds and hundreds of abstracts that will obviously be available, as well as posters that people can take a look at. And then we're bringing back, of course, debates and panels, which people are very much excited about, and ask the expert type sessions. But as per usual, there's also going to be first in world readouts of some exciting clinical trials. Right. So just to name a bunch of acronyms, and then people can look up and see what they're specifically about. But there's the LENS trial that we'll be reading out, TIGHT, the names are great, eh? Mm-hmm. LENS, TIGHT, ATTEMPT, there's CATALYST as well. And then we're also going to hear about SURMOUNT OSA. Okay. We're also going to see some newer data from trials that have already read out in terms of their primary outcomes, but we'll see newer data from STEP-HFpEF and STEP-HFpEF-DM, as well as from SELECT, and as well as from FLOW. So these are just some acronyms of trials that we're going to be excited to hear about. But in addition, we're going to see some guidance documents that I think will be critical, such as management of hyperglycemic crises in diabetes, as well as one there's a lot of excitement around is how to monitor when we're looking at early stage type 1 diabetes. So there's lots and lots of cool stuff that people can look forward to.
Something for everyone.
Absolutely.
Definitely. So for you personally, any session that you are most looking forward to, or any topic that's going to be debated or discussed?
Yeah, that's a tough one because there's over 200 to choose from. But
it's like picking a favorite child.
Right? Seriously, like you really can. And I kind of wish I could clone myself. But if I had to pick one, I think the one that I would pick is Saturday at 3:15. There's going to be a panel discussion on a very hot clinical topic, which is looking at GLP-1 plus or minus GIP receptor agonists in the perioperative setting. To stop or not to stop. And this has become a very hot topic in the past year or so because of some guidelines coming out from other societies that have suggested stopping, and then another one suggesting not stopping, and then we're kind of stuck with what do we do. Right. And then of course the people we serve, the patients, are also stuck in the middle. So I really look forward to this panel, which I assume is going to be a very collaborative one where we'll learn from other specialties and try to come up with, okay, well, what do I do, next week when I get back to the clinic, and what do we advise?
Yeah, how can I implement this?
Exactly.
All right, final question for you. What is always a highlight of this meeting for you? I know you've had obviously a very big hand in planning of the scientific sessions, but the networking? What really stands out for you personally?
So the part that I love best is the energy of being at a conference with, as I affectionately call all of us, a bunch of diabetes nerds, right? So just hanging out with a bunch of diabetes nerds
Right.
and hearing perspectives from different parts of the world, different areas of interest within the diabetes space. And I really hope that people walk away feeling inspired, energized, and hopefully with some grand ideas of their next project, and meeting some potential collaborators from the other side of the world. So that's really what I hope I will get, as well as people will get from attending.
Wonderful. Well, I know your committee has worked so hard, as have you, on putting this entire week together. So thank you for all of your work, and thank you for your time today.
Thank you.